It's very important that we don't lose sight of the fact that even though the opioid epidemic has kind of regressed a little bit in the rearview mirror, the COVID pandemic happened, we've been paying attention to lots of other things in society, but the opioid crisis actually continued to increase. The number of overdoses has continued to increase, and the danger of the substances that are available now on the street has continued to increase. I think it's important that people not be terrified of using opioids, but it's very important that people have the proper amount of respect for the power of these medications. So when we talk about using opioids safely, only when they're absolutely necessary. We need them in the operating room. We need them to help people when they're recovering from surgery. There are people who need to take opioids chronically, but the number of people who need to be on opioids for any length of time should be as low as possible. The doses should be kept as low as possible, and we should make every possible effort to separate people from opioids because they can create other effects which are very subtle and hard to imagine can occur in advance. One person can be very careful about how they take their own medication, but we all have family, we have other people who come into our homes, and opioids, like it or not, are a very sought after commodity that can be extremely dangerous when they're taken by the wrong person. And that's the whole concept of diversion. When somebody gets a prescription for an opioid because they had an operation, but they give that to a friend, or somebody steals it from them, or somebody, even with the best of intent, takes it because you're trying to help them, but they have a medical condition that's not really compatible with taking an opioid, and you can cause real harm, including death. The most important thing is to only store opioids if you're using them. Once you're done with the opioids, it's important that they be disposed of properly, but while you have them, they need to be stored in a locked area that's not accessible accidentally to a child, and that's not accessible to somebody who's intentionally looking for opioids. So a locked box is the best way to do that. The best way to taper off opioids safely is to do that under the care of the prescriber. They should be advising you when they give the prescription how to come off the prescription in a safe way. At Hospital for Special Surgery, we have resources available on our website, which will give patients some basic information. We have information that's available to prescribers at the hospital, which is called a tapering tool that will allow them to pre-print a graphic instruction sheet for the patients, and the patients can receive that when they get their opioid prescription from their prescriber. But the general principle is that as you reduce opioid pain medications when you no longer need them, the body, having become used to being on them, can still generate pain from having been on the opioids. And it's important to recognize that, to do the process in an organized way, slowly, rather than just by abruptly stopping the medication. The most important thing would be to make sure that you're aware of what medications your family member is on or your friend is on, to make sure that they're using the medication that's appropriate. And if they're at increased risk, and there are a lot of things that increase the risk of taking opioids, for example, using other drugs, having a history of addiction, a history of using alcohol, even having sleep apnea, which is amazingly common. It's very important that we're aware that there are things that we can do to reverse an overdose, which may not be intentional, and it can occur even with prescribed use of medication. We have naloxone rescue inhalers. The most important thing people could do would be to become trained on how to use these. They're very simple, and they're really the fastest way to reverse an opioid overdose.